When I think about family planning and motherhood, it was definitely always something that I really, really wanted. Like many women, it was also kind of, in a bit of a fight at the same time with my own personal goals and my career. It's really, really hard as a woman where I'm trying to grow my practice, write my book, build my career, and at the same time, I'm also trying to grow a family. And you can absolutely do both. It just takes some jiggling and working around in order for you to feel like you can achieve those things. I'm a naturopathic doctor here in Toronto. I have a special focus in fertility and hormones. So I love helping anyone along their fertility journey and to grow their family. Before becoming an ND, I actually did my master's, and my thesis was on the impact of nutrition and lifestyle on improving gestational outcomes. And I found it so fascinating how much we can impact egg and sperm quality and then the health of the fetus for years after that through pregnancy and things that we can do to support our patients. So for me, I found that it's such a rewarding opportunity and such a rewarding space to work in. So to help those families bring something into their life that they wanted so badly and impact the health of their fetus was just a win-win for me. And it was a natural choice for me to focus in that area of my practice. I'm also an IVF mama myself. And if you can tell from this video, I am 7 months pregnant with our second. So it's something that I'm so passionate about, helping others, having been through this journey with my partner as we grow our own family together. Well, like so many young women, when I was a teenager, I just got put on the pill for irregular periods without any formal workup. It wasn't until when I was 25 that I truly advocated for myself because of my irregular periods, my hair growth, my constant sugar cravings, that I knew something was going on and I needed to figure this out for myself. This involved getting blood work done, and specifically a pelvic ultrasound, where we could see very clearly a polycystic ovarian appearance. And then based on my blood work, we could see things like elevated LH, which is a certain hormone that we look for. We could tell that I was not ovulating on my own naturally. And putting that together with some of my clinical signs and symptoms, we were able to finally make that formal diagnosis. And this to me was actually relieving. It was nice to know what was going on and to know that I had options to treat it and something that I could make changes in order for me to feel better. It's really, really important to understand that PCOS is not your fault. So you don't have PCOS because of something you ate. We know that it is a genetic condition. If you have been diagnosed with PCOS or that you are going through IVF, as I mentioned, please do not feel like you are alone. There are so many other people struggling, and you don't have to feel like you're the only person on this journey. It certainly did make me a little bit nervous, and also was a little bit sad. And I certainly do have patients with PCOS in my practice who conceive naturally. So that's not to say if you have PCOS, you can't have a baby naturally. It can just be a little bit more difficult, and I knew this was something that may or may not be possible for me. Certainly was something that I worried about. At the same time, as a naturopath with a clinical focus on PCOS and pregnancy, I knew that there was so much I could do to help overcome that infertility that many women with PCOS face. And so focusing on reducing my risk factors when it comes to things like miscarriage, which is higher, by controlling my blood sugar, helping my body with egg quality, helping my body ovulate, helping maintain a healthy body weight, which can make an impact on ovulation. All of these things together were so important. So as much as the worry was there, I also knew that there's things that I could put in place to make a big difference. And having those steps and having that knowledge was really, really key in my own fertility journey. There's things you can do now that are going to impact the health of your baby 3 months from now. Fast forward then, when it was time for me to try and conceive, it was difficult, as it is for a lot of people with PCOS, and we ended up requiring IVF in order for us to grow our family. So IVF stands for in vitro fertilization, which means fertilizing eggs outside of the body. So the first thing we do is the female is going to take hormones to help stimulate the growth of many eggs. Typically, this involves injecting yourself in the abdomen, sometimes in the glute region, with medications for about 1 to 2 weeks before an egg retrieval. It's definitely stressful. It's a lot. You're typically at the fertility clinic early in the morning every few days as they check the growth of those follicles. And it means setting a million reminders on your phone so that you don't mess up your medications. Once those ovaries are stimulated and we see lots of mature follicles, and those follicles are what contain the egg, we actually go in and extract the eggs, and then they will be combined with the sperm outside of the body. And hopefully what we want to see is that those eggs become fertilized, creating embryos. Those embryos are then frozen, and then we'll take each embryo one at a time and we'll transfer it back into the person's uterus in hopes of achieving a successful pregnancy. My husband and I, like many people, got caught up in COVID when we were trying to grow our family. I was actually in line to pick up my medications to start IVF when the nurse told me that they were shutting down the clinic because of COVID. So that in itself was absolutely devastating and incredibly frustrating as we waited for clinics to reopen. But then I used that time to focus on my health. And I said, all right, if this is going to be a couple months wait, that's a few more months. I can work on my egg quality. I can improve my diet. I can get outside for a walk every day. I can make sure that my husband and I spend more time together. So we use that time to really focus on our health, our mental health, our time together as a couple, and really grow and connect, so that when we were ready to do IVF, when fertility clinics reopened, I do feel like I was in a better place. And so I'm, in a weird way, thankful that we had that time together. Doing IVF is like having a second job. It's a lot. For me personally, it meant getting to the fertility clinic every morning at 7 a.m., waiting in line for an ultrasound and blood work, and then rushing to get to work, waiting to get a phone call from my nurse while I'm at work to make sure things are going well. By the end, you kind of feel like a pincushion. You've had multiple blood draws, you're injecting medications into your stomach, you're having ultrasounds every other day, and mentally, it's a roller coaster. It's up and down. Your eggs get out, but then you're waiting for the fertilization rate. You're waiting to see if they grow. You're waiting after that transfer during that 2-week wait to see if your pregnancy test is positive. And so you can go from feeling really great one day to feeling really, really down when you get your next result. And it's such an emotional roller coaster. And having the support of a partner, a social worker, a naturopathic doctor on your side can be very important, because we know when people have more support, they have more success. IVF success rates on their own are around about 30% per transfer, which is not that good. But when we combine IVF with naturopathic medicine, with supplementation, with acupuncture, with targeted nutrition and lifestyle, we're gonna see better outcomes. And so I knew that if we do both, having that integrative approach would give us the best chances of success. It can be totally worth it at the end if you're able to bring home that baby. It's really bittersweet. It's tough because on one hand you're so excited, and on the other hand you're so scared, because you know that things can still happen, that this might not stick. And so while people think about pregnancy being a happy time, for myself, and I will say for most of my patients who go through IVF, that beginning first few weeks, it's not. You're waiting for the next ultrasound. You feel like you're constantly walking on eggshells. And with each step, you breathe a little bit of a sigh of relief, but it can be really, really hard as you're kind of going through until you can kind of get through that first trimester, or even until you deliver the baby for a lot of people. Often people have been struggling with infertility for years, and they just can't believe that they're finally pregnant and they don't know how to feel. So as much as it's joyous, it's also very nerve-wracking, and it's hard to kind of be happy until you kind of get that reassurance with each step of the way. And that's what I personally experienced, is I found that I couldn't fully relax and enjoy it because you're kind of waiting for that other shoe to drop. And so making sure that I continually focus on my health and my needs helped me feel a little bit more reassured during my pregnancy and enjoy the process. I will say overall, although I had a lot more complications, I had a really positive experience because I felt empowered and supported. With my second pregnancy, I was diagnosed with something called hyperemesis gravidarum, which is the severe form of nausea and vomiting in pregnancy. This means that I was often throwing up 8 to 10 times a day and unable to keep any food or fluids down. The serious condition that for myself actually required hospitalization in order for me to get it under control, and taking a medication for my entire pregnancy for me to control that. So while some women feel great during pregnancy, I've never been that person, and maybe I will be one day, but I'm also so happy and grateful. But it's not necessarily the easiest time for a lot of women, and that's okay. It's okay to want something so badly, to work for so hard, to go through IVF, and to not feel like you're loving every minute. It's totally fine as well. Wow, it's so amazing to watch them grow and learn, and how he's gone from this little tiny baby to this full human who's speaking sentences with, well, I should say it's a lot of no, it's a lot of attitude, not necessarily sentences at this age. There's something to be said about the terrible twos, but it's also so fun. It is so, so much fun. I'm most excited to see Jake be a big brother. He's one of those amazing but totally wild kids who never sits down. And I think it'll be so fun to watch his interaction with baby and how they kind of bond, the two of them. Mom guilt, oh my gosh, this was huge when I first went back to work. This was part of the tough part when I think about community, when I would see a lot of moms who would be on a year-long mat leave, where it's for myself, being self-employed, not having any EI, also trying to keep my practice afloat and make sure my patients feel taken care of. I went back to work at 3 months, which is very common for our industry, but not necessarily common for other moms. And the comments you would get about like, well, who's gonna watch the baby? Or aren't you gonna miss him? It really starts to get to you as that guilt. For me personally, being a working mom makes me a better mother at home, because I get that time with my patients where I just feel so rewarded in my profession that then when I come home, I'm more excited to spend time with Jake. But it's not perfect. I totally have my days where I feel guilty, or maybe we're throwing a frozen pizza in the oven for dinner because I got stuck at work late instead of making something homemade. And it used to, I think, bug me more, and now I just let it slide, and I remind myself, like, we're doing the best we can. He's happy and healthy. I'm a better mom if I'm working, and this is what's right for our family. So when people kind of, give me that weird stare when they hear about my maternity plans, I say, this is what's best for our family, and that's what we decided on. And being assertive and being confident in what you need to do as a mom is what matters most, not what other people think of you. What I will say is that I try my best to balance, but it's never perfect. If I think about, my career, being a mom, being a kid, there's all these different buckets. And sometimes, I achieve more in one bucket, other days, not so much, right? Like, it's never gonna be a perfect balance, and it always maybe comes with a compromise to one area, but I'm okay with knowing I do my best. For myself, it meant being in a practice where I had very good admin support, because at the end of the day, I want to go home and spend time with my son. So that was about me ensuring that those steps were in place. It means delegating as much as I can, and a true delegation, meaning if I give that task to someone else, I then don't micromanage it, I let it pass. It means setting boundaries with my patients where I love them and I will do my very best for them. But as I say, after hours or on the weekend, that's my family time, and I'm not looking at work-related emails. It means making sure that my schedule is set up so that I see patients during the time that doesn't interfere with my family time, and that then I don't feel totally exhausted and burnt out. So putting those kind of steps in place and being more preventative has helped me have a much better balance and make me feel like a better mom when I'm at home.